makes a whole lot more sense for me to wear a mask than you to wear a mask, because I'm controlling that spread of the virus as opposed to aerosolizing it all over the place. And even if you have a pretty good mask, you're going to breathe some of that in. So me wearing the mask and minimizing how much I'm breathing out is going to be the most effective thing. But as far as having vaccinated people wear masks, it's probably mostly, I would say, because of that equal viral load in that 2-day period. So if I happen to have a breakthrough infection, I'm vaccinated. Chances are I may have an asymptomatic infection because I'm vaccinated. It's not going to, get down into my lungs and cause infection, but it's still going to be in my nasal cavities and my throat. And I'm still going to kind of breathe it out as I'm walking around, even if I don't feel it. And so by me wearing a mask when I'm around somebody who's unvaccinated, I'm really protecting them. There is some protection for me because I could get a breakthrough infection. It's a lot less likely. But the main protection is really for people who are unvaccinated.
Heads up that we are live on YouTube and we're about 2 minutes out from the start of the webinar.
Sounds good. Good question.
And then Ben, I think I told you we'll bring you up in the second part of the show if that's okay.
Yep, sounds good.
And you do have slides to share?
I'll share a few trends on the dashboard. So I'll just share my screen. Yeah,
no problem. All right, 1 minute. And 30 seconds. Well, good morning, everyone. I'm quite clearly not Tim Sheehy. My name is Chris Jenkins. I'm the Communications Director for MMAC. Tim is traveling this week, and I'm happy to be here filling in while he's out. Welcome to another edition of the Business of Metro Milwaukee. This is our monthly webinar providing insights on the business of Metro Milwaukee. This series puts a spotlight on the challenges and opportunities we face in sustaining and growing the region's prosperity. We hope that these insights will help shape your business and inspire you to help shape the region's future. The Delta variant of COVID-19 continues to challenge our business community and our overall community. And we're excited to have some great guests here today to provide some insights. Joining us today are Carrie Atkinson, Vice President of Employee Rewards and Experience for Manpower Group, Mark Goldstein, President of the Goldstein Law Group. And a little bit later, we'll hear from Dr. Ben Weston, a Medical College of Wisconsin Associate Professor and Medical Director at the Milwaukee County Office of Emergency Management. But first, a word from our sponsor. Today's program is sponsored by Unitedhealthcare. Unitedhealthcare is working with the MMAC to help make it easier for you to find a health plan that works for your employees and your bottom line. That's why when you work with an MMAC affiliated broker, you'll receive discounted rates on Unitedhealthcare's All Savers alternate funding health plans. Plus, you have the option to add other Unitedhealthcare plans to your employee benefits package, such as specialty plans and supplemental financial protection plans for groups with as few as 5 employees. Contact your MMAC broker or visit mmAC.org to learn more. And now on to today's discussion. Carrie, I'll start with you. How have Manpower's return to office plans and policies changed with the emergence of the Delta variant?
Sure. So good morning. Glad to be part of this conversation. Obviously, one thing that everybody on this call, I'm sure, is experiencing is that uncertainty is the only certainty. So this summer, we did start our soft open for employees who kind of raised their hands like, hey, I want to start, building new routines, coming into the office some of the time. And with the emergence of the Delta variant, we really paused and relooked at our plans. And As other large employers across the country started requiring vaccines, we made the decision to do the same for our headquarters population. Our headquarters is the largest concentration of employees in the United States. So we made this decision, and we really took into factor of the health and safety of our employees, but also factoring in the greater collective good to help protect their families, the communities we serve, and really doing our part to be part of the solution. And we know that vaccines are key in our fight against COVID. So coming out and kind of saying, hey, we're going to delay our reopening till October 4th, and we're requiring vaccinations so that when our employees come back, they know that every guest, visitor, vendor, employee is vaccinated when they're in our headquarters building.
And Carrie, so Manpower is such a leader, both in terms of talking to your own staff, but also the people you place out in the field. How do you sort of get a sense of how all those different audiences are feeling? And do you survey them regularly? And does all that play a role into your decision making?
Yeah, absolutely. Surveys play a role. We work closely with our clients, and oftentimes we're the thought partner. And this is where we're very lucky to be in the people business. That they really look to us to say, hey, what are you doing for your employees? How can we leverage that for our consultants and associates, as well as their workforce? So we do surveys of our internal staff employees, as well as working with our clients to survey consultants and associates about what they're thinking and feeling. Of a recent survey that we did, we found that the number one thing that makes people comfortable coming back to work is truly those health and safety protocols. When you think about a manufacturing site, people having those visible cleaning protocols, that they see the visible safety practices that are happening. So it's really leveraging that voice and experience and kind of knowing, you're going to know people's hesitations. And I think the one thing I learned through this process is you really have to approach it from understanding others' experiences. There may be a personal reason why people feel strongly. So I know that's one thing that's been very challenging, but really staying plugged in and surveying and really getting that data and insight drives a lot of decisions for us as well as our clients.
Just from a nuts and bolts perspective, how big of a challenge is it to keep track of people's vaccination status and sort of keep that data protected?
Right. So we started with, again, our headquarter population, and it's been a relatively seamless process. And this is why we kind of started with that population, because we know it's the highest concentration. So we work with our People and Culture Resource Center. We're very lucky to have such a strong team that, they do accommodations and processes like this every day. I think COVID has obviously shined a light on that, and requiring vaccinations is a new world for us. But what I have found is that leading with communication and transparency and giving people very clear expectations has really made this process more smooth. And even employees who came forward with medical accommodations that were at first very hesitant, they see this requirement come out and they don't know how that process will go. I've had many employees reach out and say, thank you for, handling this with such care and treatment and, being respectful of my personal situation. So I think the biggest takeaway is really having that process in place, but communicating, being transparent, and kind of keeping a pulse check too on what employee concerns are, and knowing that some of them are truly valid.
Absolutely. Wanted to bring in Mark Goldstein as well to join the conversation. Mark, first, I guess I'll ask you the big news from last week, the Biden administration's new policies they rolled out. What were some of your main takeaways from that announcement?
Well, Chris, thanks for having me. I guess my main takeaway, I'll offer you two. One is I feel like the administration felt like they had to do something, that this was a moment, and a precarious moment, with infections and hospitalizations and deaths increasing in other parts of the country, and here too with health systems taxed to capacity in some respects. I think there's a feeling that in light of the season, kids going back to school and so on, that this was a moment that something had to be done. Which leads me to my second takeaway, and that is we'll see how productive this is. I know there's been a lot of pushback. Some employers who are doing a lot of this on their own feel like, well, this might not be helpful. And others might be happy to have a little bit of cover saying, I don't have to worry about pushing on this issue because my employees are not going to leave in this tight labor market for another employer because they're going to be bound by all the same rules and regulations. So those are two takeaways, that it represents the moment we're in, but it also represents a jostling that's going to happen within the government in terms of rulemaking and the specifics to follow, but also between business community and government, between employer and employee.
Yeah, Mark, I did want to ask you, it'll be at least a couple of weeks before we see the full rules written up, as I understand. Is it written in stone that this will survive legal challenges, or is that very much an open question right now?
Not at all. I do think a few things are fairly settled, and then others will be a challenge. I'll give you a couple on each end of it. It is fairly settled that the government can mandate vaccination. This has been done for kids going to school for decades. And yes, there are waiver protocols, but those are, applied to somewhere between 0.25% to maybe 3% of the population. By and large, kids get vaccinated when they go to school, and those who are not vaccinated are subject to other rules and particulars. So I think that's something that the government certainly can do. The other thing the government can certainly do is to insist that federal employees and federal contractors and members of the military be vaccinated, and to insist that entities that are Medicare or Medicaid entities, healthcare entities, mandate vaccination. So I think in those areas, it's pretty settled territory. Two areas where it may not be so settled. Number one, although the government has done this historically in lots of ways, smallpox and polio and other ways, this is done by executive order and not by legislation, although you could argue that OSHA is created by legislation, and by extension, it's happening by legislation. But I think that will be subject to litigation. And then, of course, there is the whole rulemaking process. How do we count 100? How do we deal with testing? How do we deal with side effects of vaccination? So I think a lot of that stuff is still to be sorted out, and certainly a few governors have had something to say about that.
And I wanted to invite our audience to enter any questions you might have, either in the Q&A function or in the chat function. We'll try to get to as many as we can. Carrie, assuming this does go through, there's about to be a lot of companies potentially starting on the same journey that Manpower has already been through. What takeaways could you sort of recommend for other companies that may have to go through all the steps it takes to implement a vaccine mandate?
Yeah, the interesting thing is, just this morning I already had 3 outreaches from clients that are pursuing this and, kind of working through what their process is. So, my advice is, when you look at the network of MMAC and other colleagues across the area, I think tap into your network. That was really key as we started to establish our processes. What are you doing for accommodation? How are you handling vendors that come into your buildings, and just really leveraging the network, I think, has been really helpful. I think as we've navigated the pandemic, that has been invaluable to us. So I'd say leverage your network, establish your process, and really walk through the steps to understand what does accommodation look like, being clear on timelines. And one of the things we've done is direct outreach to employees. So we kind of did the broader communication. Hey, this is what the expectations are. This is the why. This is why we made this decision, and this is how it will protect our employees. And then really starting to kind of track where are we at from vaccination standpoint. So we're just a few weeks out. We're doing direct outreach to employees to say, hey, we have yet to receive it. Some employees are saying, oh, completely forgot, why waste a good deadline? Others are reaching out with questions. But I would say that's probably where we've been successful, is being really clear and transparent, setting up a clear process for accommodations. And as I said, our HR teams are trained to do this. It's just new, there's new questions, new considerations. And, as I'm sure you've all been experiencing, there's emotions around it, and decisions and family discussions that have to happen. And the second piece of advice I would give you is have a little bit of grace in your process. So we say October 4th is our deadline because that's when we're going to start returning. But we really built in a flexibility to that. If an employee says, hey, I got my first dose, but I'm not through the vaccination process, we're putting a little bit of grace into that process. And then when it comes to accommodations, we're also being very clear that the accommodation is granted till January, and at what point we'll reassess. Again, so much has changed. And I think if you communicate clearly that we continue to monitor, and we're going to make informed choices based on the data we have. That just reinforces, that things could change.
Absolutely. Mark, we had a question from an audience member. Can the government mandate vaccinations for private entities?
Yes. Can I take the opportunity to just build on a few things that Carrie mentioned?
Absolutely.
So Carrie, her first comment was, I think, a very useful one, which is, early on, maybe last May, there was real public pushback against this idea of passports and this idea of, looking at people's records. But we're at a point where employers really need to see those. And not only because we have to know who's vaccinated, who's not, but also at some point they'll expire, or there might be a need for boosters or so on. So tracking that is absolutely critical. And then just to build on this point about grace, it's been said many times by many people, there's really no point in shaming folks into vaccination or trying to convince them at this point. We've seen the whole spectrum. We've seen people who said, "Oh, you mean I need to get? I will get vaccinated," and they're to the Walgreens or to the doctor the next day or that day. And there are others who are very insistent. So not treating the group as a monolith and understanding that beyond religious and medical issues, which you can decide on your own how aggressive or assertive you want to be in challenging, there are other reasons that people have taken this position, and bringing them along as late as this is an art form. Absolutely.
Mark, another question for you. Do you believe there is a legal basis for the enforcement penalty of $14,000 per violation?
That's a great question. I think the answer, again, I would say is yes, but I'll give a caveat here. So you may recall that this is kind of where a lot of the litigation over the Affordable Care Act was. It was about these kinds of penalties. And I think there will be a lot to be determined in terms of rulemaking, right? What constitutes a violation? There's a lot of talk, I don't think this is a secret, as to how could OSHA possibly enforce this and do enough inspections to do a reasonable effort at sizing this up. So there's a practical issue there. There's a legal issue there. That I think will certainly be the subject of some battle coming in the coming weeks.
Carrie, a question for you from the audience. Has Manpower experienced any employees quitting because of the vaccination mandate?
Not at this time. So we're still very much going through the process of working with employees directly. What I have found is that most of those have reached out and requested an accommodation. There's always the concern out there. Well, will people just say they have a religious belief and, they don't truly have a deeply held belief? Through the process, they're attesting that they're being honest and truthful in the statements that they're making. So what I have found is that most employees have been grateful for this. The vast majority are saying, thank you for doing that. For those who truly have personal reasons for accommodations, whether religious, medical, or otherwise, are going through that process. So to date, we have not really, there have not been no direct cases where somebody says, I'm going to quit as a result of this. Conversely, we've heard from employees who said, I was just waiting for this final push. I'm going to go out and get it. So I think that balance of accommodation, and I think the other thing that we really factored in is as we return, we're not going back to how we used to work. We have flexibility built into it that people are coming in the office 2 to 3 days a week. And I think that gives people some confidence too, that we're not just pushing vaccines to get people back to the office. Like, we're really trying to protect the health and safety, and we believe it's the right thing to do. So far, we have not encountered that, but I believe in the coming weeks, as we start to kind of get down to those individual cases, there might be some tough decisions. And as Mark pointed out, it may be a personal choice that they choose to not get vaccinated. And that is a decision that they're making. And we have to treat people with the utmost respect in that process.
Yeah, Carrie, as a follow-up to that, I know it's challenging for a company the size of Manpower to manage sort of a crisis for a year or more, but I also know that Manpower takes a very long-term view on things. How do you see decisions about return to work and vaccination affecting your long-term recruiting strategy, both for employees at your headquarters and people you recruit to go out in the field?
Yeah, I think, what we see from our own thought leadership and what we hear, from our employee base and clients is it's carrying forward what we learned in the last 18 months. And when we look at what workers want, it's change. And it has accelerated many changes. And there have been things that we didn't expect to happen.
So I think it is truly looking beyond the crisis of what do you carry forward. So when I talk about the flexibility, that's critical. As we talk about returning to the office, there's still going to be a role for the office, right? There's connection, collaboration. When we surveyed our employees, 90% of them said the reason they want to come back is because of that connection. I think the other thing that a lot of employers are trying to balance right now is this whole concept. If employees have been working remote for 18 months, it's a pretty big shift now to have them come back. It's like starting to work out again and building those muscles. The thing that I love is we support a field organization and clients who've been working in an office, in a manufacturing site since last June. So we always have that leverage to kind of learn from who are those essential workers that went back right away versus this population that has been remote longer. And what we've learned is that flexibility, regardless of role, job, to start later in the day or leave early to take your kids to soccer or have some convergence of kind of that personal and work, that's here to stay. So I would say the biggest takeaway is you do have to lean into what employees want in the future, but also understand the role of the workplace and collaboration and what that brings to an organization.
Absolutely. Thank you. Mark, a question from an attendee. If all this holds up legally, will this prevent employers from being liable for health issues and side effects that may not yet be known from the vaccines, given that they're less than 1 year in the market? And I'm going to channel Dr. Weston here before he appears and say that most of the time, if you see side effects for the vaccine, as I understand it, it would be in weeks, not years. But we'll ask him about that later. For you, the liability question.
Yeah, I'm going to go out on a limb because it's not yet settled at all and say that if this does come to be, that there will be some kind of companion legislation or rulemaking that says that employers have protection in this regard. I owe it to you to add one other point, again, building off what Carrie just shared, and that is that we're really in a confounding moment because while everything Carrie said is true about desire to get back, and especially for folks who are able to come back or need to come back, can't work remotely, there is an aspect of this directive that suggests, and the Department of Labor said this on Friday, that it might not apply to people working remotely. Well, that will drive employers a little bit crazy because now it creates kind of a converse or a disincentive or a whatever you want to call it. Someone might just say, well, I'll just continue to work remotely, and that may or may not work for the employers. So that's another wrinkle to all this. But I would have to think that as this goes through, there will be protection for employers related to any side effects. Also worth noting, or important to note, that if it goes through or when it goes through, that employers are required to provide PTO or paid time off for employees who are getting vaccinated. Although employer can require that the employee use their own PTO first.
Absolutely. Carrie, we had a couple of questions in the chat here about accommodations. First of all, people who've received accommodations, do they have to get tested regularly? And another question, what other accommodations can you make for somebody who has, say, a religious exemption or something along those lines?
Yeah, so for our religious and medical accommodations that we've granted so far, most of those roles can continue to work remote. I think where we're challenged is where there are roles where there are in-person duties. So I'll give you an example. Our global headquarters, we have front desk ambassadors who greet guests as they come in. They help employees with concerns. That's an in-person role, right? So it's kind of taking in what are the accommodations that we can make. But in most cases, we've been able to grant them that they can continue to work remote based on the duties of their role. So I think that's a really important consideration as you're making the accommodation, that you're also looking at the job duties. Is there a different position that they could apply for? But we will not allow anybody who's not vaccinated to be in the building. That is part of the policy. So it's just been something that we've had to navigate, but so far, a lot of them we can grant that remote work.
Well, we have a few more minutes before we bring Dr. Weston in. So if anybody has any additional questions, go ahead and put them in the Q&A or the chat. A question for perhaps each of you, because it seems unclear to me, who pays for the tests that are required of employees who remain unvaccinated under the new policy?
To be determined, but I think it's fair to say it won't be the employer. I do think going to something that was just discussed, this idea of weekly testing and what that involves in terms of travel to and fro and keeping records of all that will be a challenge. But it'll either be paid for by insurance or by the employee, I would imagine.
Yeah, and I actually think that is from an employer perspective, obviously for our headquarters, we're requiring vaccinations, right? But if employers make the decision that they don't want to require it and they want to choose the testing option, that's where, from a logistics standpoint, that's one of the scenarios we're talking through for our field organization too. Of what would that look like? How would you collect it? How would you monitor it? It would have to be relatively sophisticated process. But that's just one of the things that we're kind of scenario planning with we actually have a vaccine risk management team kind of looking at some of this and thinking through what this looks like.
And there's another important point here, and that is that employers are free to and have been doing a whole lot more than what this directive requires. So a number of employers have been doing, as Carrie suggested, you cannot come in unless you've been vaccinated, or testing and masking, or whatever it might be. But employers are free to do that, and in many respects have been doing more than that. As I say, where it gets a little complicated is continued remote work and so on, and then also how aggressive do we want to be in challenging a medical statement or a religious statement? Is this truly a medical situation? Is this sincerely held religious belief? And I know that some employers are saying, well, hold on a second, I want to hear it from someone in authority, a pastor, a minister, the head of your church, not just your own personal statement on a piece of paper. So employers are trying to decide, okay, how assertive should I be in that regard? And if that means that this employee works remotely, or if that means this employee can't work for us anymore, those are two very different scenarios.
Yeah, another question, would the testing, the time taken to go take a test, fall under paid time off for employees?
It does.
And then also probably for Mark, have you heard anything on the ARPA sick leave being extended past September 30th?
We have not. But I would say that it's possible that we do hear that in the coming weeks because we are approaching that deadline, because it has been a lifeline for many, and because of the new directive.
A very good nuts and bolts procedural question here, maybe for Carrie, you, but Mark, you could speak to what maybe some of your clients are doing. Have you requested a copy of colleagues' vaccine cards, or are they completing an attestation that they've received the vaccine?
Where we're requiring it, we're actually requiring proof of vaccination that we are maintaining separate from their employment record. And we do have, although I'm not sure this is a requirement, we actually are requiring HIPAA training for anybody that's involved in that process of collecting it and securing it. So I think that was kind of a best practice, is to go through that HIPAA training again, even if they've done it before, but we are collecting it where it's mandated.
Yeah, I agree with both of those comments. And I would say that this really harkens back to like the I-9 discussions from years back about, do we collect cards or make copies of cards? Do we not? Now there's a feeling like there's enough fraud, misunderstanding, misremembering that we should have a record of what we looked at and what we relied upon.
Absolutely. Another question for you, Mark, for companies that are maybe in that the smaller side of the 100+ range, how challenging is all this in terms of just logistics if you don't have like a large, well built out HR department?
It's very challenging, although if one keeps what Carrie was talking about front and center, which is at the core, a healthy workforce means a productive workforce. And what we haven't talked about is the people who are vaccinated, the people who are anxious about working with folks who are not vaccinated. We're now at about 70 to 75% of the population that's vaccinated. And when you envision that children under 12 cannot be vaccinated, that's a pretty sizable number. We're never going to get past 92, 95, but we should get into the 80s. That's a lot of folks who are hoping and relying upon a safe workplace. So I think the short of it is, if that's front and center, if that's driving your decision-making, then all of a sudden masks, hand washing, social distancing, and being a little more assertive on this front is all worth doing. Now, I'd add one other point, and that is I've been amazed by how many folks, you talk to them again, you have a clinic on site, you talk to them again, and lo and behold, they get vaccinated. So I'd encourage employers who have kind of given up saying, my people won't. Well, maybe tomorrow they will. And I wouldn't give up on that, but it is very challenging. And it's especially challenging in light of the fact that rolling into the summer, we kind of thought we were past this. And now we're looking at something all too familiar.
Mark, another legal question for you. If a company stopped doing FFRCA as of 3/31, can they decide to start that again? And I believe that may refer to the Families First Coronavirus Response Act, employer paid leave, if I have that correct.
Correct. So, I'm going to wing it a little bit and say, yes and no, the lawyerly answer. Yes, in the sense that the employer could always make that decision to continue that. But the challenge is going to be how many instances have there been since March that were denied or refused, and how do we look back on those if we're going to do it going forward? Plus, as you indicated, it's just a few more weeks on some of this, so it's a yes and no answer.
Absolutely. Well, I guess I'll close this segment of our program by asking each of you what you expect to see next.
More uncertainty. No. I think it is just being adaptable, because we don't know what to expect. The thing that's top of mind for me is cold and flu season. So we have schools, we have cold and flu season, we have tough decisions to make, we have potential regulations coming. So I think it is, again, tap into your network. Anyone on this call can reach out to me, have their HR teams reach out to me. But I think that's going to be so invaluable as we kind of navigate this together, that we have to be adaptable for what's to come. But it's all about protecting the health and safety of our people in our communities.
And I would say I feel very fortunate that in light of what we do, that every day I'm exposed to situations where someone got COVID, someone is a long haul COVID person, death, intubation, all these things that keep it front and center. It's easy to become a little complacent about this because we're weary and we've been languishing for many months now. So that to me serves as a daily reminder as to what we're playing for and what this is all about. And what makes me anxious is we're heading into cooler weather, cold and flu season, and anything we can do to keep our people safe, I think is worth doing.
Absolutely. Well, Carrie, Mark, thank you so much for your time. We really appreciate both your time and your perspective. Thanks for being here today.
Thank you.
We'll bring in Dr. Weston at this point. Dr. Weston, welcome. Thank you so much for being here. Dr. Raymond had a conflict today, but we have a very deep bench of medical experts thanks to our partnership with the Medical College throughout the pandemic, and we're glad to have you here.
Yeah, thanks for having me back.
Absolutely. So I guess I'll start out really generally with, and I don't know if you wanted to present anything, kind of what you're seeing in terms of trends.
Yeah, so let me, if I can share my screen here for just a minute, I'll share a few trends. I'll go through it briefly. So I'll focus here on Milwaukee County. And you can see this is our county dashboard. And I'll start with our cases. We're seeing kind of a strange trend that we haven't frankly seen at any other point in the pandemic. And that's this plateau of cases in Milwaukee County. You can see throughout, this is from the very beginning, it's been just this up and down. We haven't really seen this stable state for any other point. And so, of course, the question then is, will we go up or will we go down? And we can certainly talk more about that as we go along. Now, when we look at our positivity rates, we're seeing similar, and that's down here. You can see maybe a slight downtrend, but pretty stable positivity rates, also unlike what we've seen before in the pandemic. What hasn't been quite as stable are hospitalizations. Those continue to rise. We might be seeing a little bit of a leveling, which hopefully is the case, but certainly rising hospitalizations in our community, about 240, 250 people currently hospitalized with COVID in our county. The vaccine data has also been steady. So right around 1,000 or so vaccines per day. And so these are new doses, not booster doses, not second doses, but new people seeking out vaccine. And in Milwaukee County, it's about 1,000 people per day. Certainly not what we saw back at some peak time periods, but at least we keep chugging along, keep getting people vaccinated. And then one of the last things I'll show is just the differences in age groups. So especially for those with kids thinking about back to school, you can see here, and hopefully this isn't too small, but you can see the breakouts by age. And you can see that the ages that are having the highest positivity rates, this is for the whole county, is that 10 to 14-year-old age group. Whereas as a county in general, we're about 9% positivity. In that 10 to 14-year-old age group, we're over 17% positivity. And that's followed not too far behind by the two other second highest age groups, which is the 15 to 19-year-olds and the 5 to 9-year-olds. So that range, that 5 to 19-year-olds, is showing anywhere from about 13 to 17% positivity. And those numbers are just going up as more and more kids are going back to school. So certainly something to keep an eye on, and an item of concern for anyone with kids.
Yeah,
so I'll pause there.
Sure.
Go ahead.
Are we any closer to getting the vaccine approved for younger children?
I think it's coming soon. It sounds like that Pfizer at least will give their 5 to 11-year-old numbers to the FDA at the end of this month. I think the most optimistic estimates, and we are hearing talk of this, is that it'll be about a month for the FDA to approve. So fingers crossed, we may see approval down to 5-year-olds for Pfizer specifically by the end of October, which would be welcome news for many parents in our community.
Well, I prepared a bunch of questions for you, but I wanted to first touch on something that was brought up in the first part of our program, which was sort of this concern that you hear a lot about. Well, these vaccines are new and we don't know the long-term health effects of them. But if I understand correctly, usually if you see a side effect of a vaccine, it would be within weeks and not years. Is that accurate? And can you provide any context around that?
That's exactly right. So when you think of the medicines you take every day, your blood pressure medicines, your cholesterol medicines, your heart medicines, you're putting those in your body every single day. And so you can imagine with medications like that, they might cause long-term effects because they are changing in some ways your body over time, over years, over decades. The vaccine just works differently. So what the vaccine does is it goes into your body. It trains your body to recognize a spike protein. So that's one of those little Y things you see on the vaccine. It trains your body to recognize that. But then as soon as your body is trained to recognize that, the vaccine breaks down and it leaves your body. And so it doesn't have these long-term, long-lasting effects. It's not like we're getting vaccine shots every single day of our life and whatever's in there is building up in our body. And so that's why when we look at really the history of vaccines, which is a long history, side effects turn up within about 6 to 8 weeks of getting the vaccine. So now sometimes those side effects are extremely rare. So think of the blood clots with J&J. Right. So those blood clots in those individuals did show up within 6 to 8 weeks. Now, to recognize that signal, since we're just talking a couple people in a million, it took a few months to notice that. But as far as an individual having a side effect from the vaccine, you'd expect to have that within 6 to 8 weeks.
One question I had is how concerned should we be right now about hospital capacity, both in Wisconsin as a whole and in the Milwaukee region here?
So I think we should be concerned. Now, if we've learned anything in this pandemic, it's that we are not isolated. What happens in other states and other countries affects us as well. So when we see overwhelmed hospitals in other parts of the country, we can't be naive that we could be there as well in weeks or in months. So right now in Wisconsin, we have about 92% of ICU beds that are full statewide. In our southeastern region, we're at about 93%. Now, other regions aren't as well off. You think of the Northwest, they're around 97% full. Any way you look at it, these are high operating capacities for hospitals. It doesn't leave a lot of room for increased needs from patients. And you couple that with nursing shortages, slow vaccine uptake, and what we're seeing in other states, and you can see that we certainly should be remaining cautious.
Right. For context, an ICU typically is about 70%. Is that right?
Yeah, I mean, on average, now some hospitals are busier than others, but on average, when you look at hospitals across the region, yeah, you want to keep it around 70, 75%, somewhere in there.
Right. And if it's full, it doesn't matter if you get COVID or you get in a car accident, it's challenging either way, right? Right.
And we've heard these stories in certain states, especially down in the South, of people who have heart conditions, have traumatic events, and there just isn't room for them at one hospital. So they're actually shopping around trying to find a hospital for these people.
Absolutely. So obviously one of the most pressing topics we're facing as of last week is the Biden administration's new policy announcements. From your perspective, what were some of your main takeaways from those announcements?
So my takeaway is that, frankly, more people need to be vaccinated for the health of the country. And these are methods to make that happen. Look, we have the silver bullet for this pandemic. We could not ask for a better vaccine. It's incredibly safe. It's extremely effective. So the more people that get the vaccine, the better it is for all of us.
Absolutely. What can employers do to be ready for this, assuming any legal challenges don't sort of gum up the works?
Well, there's a lot of precedent for how to employ these vaccines requirements at this point in businesses. So I think rather than recreating the wheel, companies that are not familiar with vaccine requirements can reach out to other entities, whether it's public health, local governments, health systems, to understand how to implement this in a successful way from a logistics standpoint. But just as importantly is offering the opportunity for questions from employees. So I'll tell you, when we in Milwaukee County implemented our vaccine requirement, we held several town halls. We continue to hold town halls. And at every one, we received many, many questions. And whether it's at those town halls or at somebody's bedside in the emergency, I find a lot of people have just a simple question or two that they still want answered. And they want it answered from a reliable source before they feel comfortable getting the vaccine. And a lot of times, once they have that question answered, they feel okay with it. They understand better how the vaccine works and they have their question addressed. So we need to ensure that those questions are getting answered.
Can you recall a couple of examples of those questions that you kept hearing?
Yeah, absolutely. I mean, some are just as simple as, I don't understand how the vaccine works. Now, we could do a 5-hour long lecture about how the vaccine works, but we can also do a 30-second discussion about how the vaccine works. And people feel a lot more comfortable once they understand that. Other people wonder, does the vaccine change my DNA? Answer, absolutely not. Can the vaccine give me COVID? Absolutely not. Is the vaccine safe in pregnancy? Absolutely. Now there's, these are the 2-second answers. There's 60-second answers that can give a little more information, a little more evidence as to why that's true.
One question from the chat is a very good one that I hear a lot. What is the history of the mRNA vaccines? Because we hear that we're new, but it's my understanding that the technology has been around a little bit longer than maybe some people think. Can you provide a little context on that?
Yeah, absolutely. So the technology has been in development for decades. These are the first mass-produced vaccines to use that technology. But really, the way that the vaccines work are very similar, whether it's the older technology or the newer technology. And basically what that is it introduces that little spike protein, which does not contain the part of the virus that makes you sick. It just takes that spike protein and introduces it into our body. There's different ways of doing it. Some use our cells machinery to do it. Some introduce it directly, but it introduces that to our body. Our body's immune system recognizes that little part of the virus, that little spike protein. And then the next time when we're exposed to the whole virus, it recognizes it and can destroy it before it gets into our body. So it's important to know, yes, mRNA vaccines are a new type of mass-produced vaccine technology, but this is technology that's been developed for decades and is ready at just the right time for this pandemic.
I think sometimes what people are implying when they ask that is they say, okay, fine, old vaccines showed side effects in a few weeks. How do we know that things won't change with a new technology? Can you assure people about that?
Yeah, I mean, none of us have a crystal ball to say in 10 years, in 20 years, what's going to happen. What we do know is very well how these vaccines work. And they work in a very similar way to how all the other vaccines work. They just are slightly different in how they interact with our cells. But the fact that they go in, they create the immune response and they leave is the same as any other vaccine. So there's no reason to think the side effects, the long-term effects are going to be any different from other vaccines.
Right, absolutely. As part of the Biden administration's announcement, testing is still an alternative for those who don't want to get vaccinated. Do we have enough access to testing right now?
Well, it's a good question. I think testing availability is going to be tight as this goes on. Now, what the Biden administration has also done is had several initiatives to make testing more accessible, whether it's rapid testing, the longer PCR testing, more accessible and more available.
Yeah, what happened to the quick turnaround tests where you just spit in a tube? What would you like to see those more widely produced and distributed?
Yeah, so actually, yes is the answer. And we are seeing more availability of that sort of rapid testing. So there's now several over-the-counter, relatively inexpensive, pop in your drugstore and you'll find them, tests. And we're talking about, $7 to $15 per test. They're quite good. It's a shallow nasal swab. You stick it in a little bit of liquid and it turns a certain color and whether you're positive or negative. These are really helpful tests to use for screening. They're also helpful when you're at home and you feel like you're getting kind of some cold symptoms and you're not quite sure. Take a quick test, make sure you don't have COVID.
Very good. Question from the Q&A function here: of hospitalizations in general and ICU hospitalizations, how many people are unvaccinated, or what percent roughly?
Yeah, so what we're seeing nationally is that the numbers vary, but it ends up being anywhere between about 10 times to about 30 times more likely to be unvaccinated people than vaccinated people. The New York Times, as well as I think it was the Washington Post, put out good studies where they showed every single state and what percentage of people were vaccinated versus unvaccinated in the hospital. And they tended to be somewhere between about 90% and 99% of people who are hospitalized are unvaccinated.
Also had a question in the chat about who's being hospitalized right now. I know we would have said maybe a year ago that it's certainly older people. Has that changed and evolved, and are children sort of showing up in those numbers now too?
That's absolutely changed. Yeah, we see when we look nationally, more children are hospitalized right now than at any other point in the pandemic. We see in Milwaukee County last week, 33% of cases, new cases, were in children 0 to 17 years old. So we're seeing a different sort of pandemic now than what we had before. Part of that is that a lot of older people are vaccinated, but the Delta strain does seem to have an affinity for younger people. It's affecting younger people a lot more than we saw before.
Absolutely. I had a question about booster shots and when vaccine efficacy starts to wane. What's the latest thought process on that?
So, the best data we're seeing on this is out of Israel. There's now data out of the UK. There's also data out of the United States. And they seem to show that after about 8, 9, 10 months, especially in older people, especially in people over 60, that vaccine immunity starts to wane a bit. And so I think we'll be seeing soon. The ACIP meets later this week, and we'll see what they announce. But I would not be at all surprised if they announce, for Pfizer at least, that people who are maybe 8 months or so out from their vaccines, that tends to be healthcare workers, those in long-term care facilities, EMS, people on the front lines, are due for a booster shot. I wouldn't be surprised if we see that announcement coming in the next week or so.
Another question from the Q&A function here. When people share that they've had severe side effects, and some say they've gone to the ER because of that, why might that happen, and how likely is it, perhaps, is the more important part of that?
Yeah, so more than 200 million people have gotten the vaccine. And so there's not many vaccines, many medications that have been given to that number of people, let alone the number of studies that have gone on for this vaccine. And so we understand very well the side effects that come from the vaccine. And most commonly, you fall into one of three groups. You either have no side effects from it, you don't even know you got it, or you have, like I had, and like many people do, which is a bit of a sore arm. It feels like you have a little bit of bruise that lasts about a day. Or you feel the immune effects. You feel your immune system building, which feels like a cold. It feels like you have some body aches. You're feeling run down. In rare cases, you get a low-grade fever. These are the common side effects that you get from the vaccine. Now, a lot of people talk about, I heard about people who had strokes. I heard about people who had heart attacks. I heard about people who had these terrible blood clots. It's important to compare those numbers to the general population. So you take 1 million people who got the vaccine and 1 million people who didn't get the vaccine. And some of those 1 million people that got the vaccine are going to have a heart attack in the 2 weeks after getting the vaccine. They're going to have a stroke. They're going to get in a car accident. You look at the 1 million people who didn't get the vaccine, and this is how we do these studies, and you see, the exact same number had heart attacks. The exact same number had strokes. The exact same number got in car accidents. And so these things are going to happen, and they're going to get reported because they have to be reported to that VAERS, that Vaccine Adverse Event Reporting System. But it's important to look for what are signal events. So what are things that are much higher in the vaccinated group, or even a little bit higher in the vaccinated group than they are in the unvaccinated group. And we haven't seen that. We haven't seen that for strokes, for heart attacks, for blood clots. We did see it for blood clots in the J&J vaccine. We're still talking a couple people in 1 million. But nonetheless, we did see that. And so it was mentioned, and it was discussed, and it was publicly disseminated.
I mean, this whole thing has sort of been a mass study in how people evaluate risk, right? What have you learned in terms of just how people evaluate and manage their own risk? Because the chances of you getting bad things happening to you because of COVID is, as I understand it, much higher than it would be by getting the vaccine, like factors higher.
Yeah, I mean, I think, one of the things that we all probably realize in our own life, it's true for me, I'm guessing it's true for you, it's probably true for everybody here, is we respond more to individual stories. We can wrap our head better around individual stories than we do around statistics and around numbers and around rates. Rates are hard to understand. And so you think about something like myocarditis, right? So there has been some association in young people with myocarditis. This is inflammation of the heart muscle. Now, when you get the vaccine and you get myocarditis, it tends to be mild. People take ibuprofen, you do just fine, it resolves. But it's important to note that you're far, 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 far more likely to get myocarditis and severe myocarditis when you have COVID than when you have the vaccine. But it doesn't make as sensational a news story. People aren't sharing those stories as much. And so you hear about the 17-year-old who got myocarditis after getting the vaccine, and that story sticks with you, as it should. I mean, we care about people. We want to hear about people's stories, but it's important to take a step back and understand the risk, and that the risk of getting the vaccine is pretty close to zero. The risk of getting COVID, the risk of hospitalization, the risk of death, but especially the risk of long COVID symptoms, these long-term symptoms that up to 30% of adults are getting, that's far from zero.
Absolutely. Got a couple of questions about the flu shot and when you should get it and whether the timing matters with when you get vaccinated. Are they separate things, or do you have to sort of sequence them? How does that work?
So they don't have to be sequenced. The CDC has released more information here that you can get them on top of each other. There's discussions now among some of the vaccine companies about, can you combine them into one shot, which people would like, get poked once rather than get poked twice. Right. I think we'll be seeing more and more of that coming, but certainly it's important to get the flu shot as well.
If you're immunocompromised due to a medication, do you have to wait a certain time to get the booster shot? If you got 2 doses in May, can you have the booster now?
So 2 different things here for immunocompromised, and the terminology that we're using, which admittedly is a little bit confusing, but for immunocompromised, we're talking additional dose. And the reason for that is because even after 2 doses, people who are immunocompromised aren't having quite as robust a response as we'd like from the vaccine. And so those people require an additional dose to really bump up their immune system and give them that full immunity that the vaccine can provide. The booster dose is different. It's for everybody. It's for whether you're immunocompromised, or it's for people who are not immunocompromised. And that's if you're a certain time out, that immunity seems to wane somewhat. You had great immunity in the beginning. It seems to start to wane, and so to bring it back up and make it strong, you get that 3rd dose. What's a little unclear right now, and I'm sure there'll be more guidance when booster doses are approved or authorized, is if you are immunocompromised, you swung by Walgreens 2 weeks ago, you got your extra shot, and then the boosters come out, should you get the booster as well? Right. My guess is no. You'll want to wait until that immunity starts waning a little bit, but we'll see what the guidance is.
Are they working on a more targeted booster shot to the Delta variant or anything else that might be coming down the road?
So yeah, certainly, the vaccine companies are working all the time on how can they improve their vaccine? Can they target them more to certain variants? The benefit of the vaccines that are out right now is they've worked extremely well against the variants. So you certainly don't want to have something that, targets Delta specifically, but then doesn't target whatever's next quite as well. But they are working on, can you have vaccines that target them better? Or if you mix vaccines, if you do a Mrna then a Pfizer, do you get better immunity in that way?
Yeah, that's one thing I was wondering about. We have yet to see a variant emerge, thank goodness, that escapes protection from vaccines. But are we kind of playing with fire when COVID is still out there mutating?
Yeah, I mean, we are, absolutely. So, every time that the virus spreads person to person, it replicates. And it replicates thousands and thousands of times. And with each of those replications, there's some mutations that take place. Now, some of those mutations do nothing, or in fact, make the vaccine less effective. But every once in a while, there's a mutation that occurs that benefits the virus. It makes it better able to enter our body or attach to our cells, or to evade our immune system. And what's good for the virus is bad for us. So when you have a less controlled spread in regions and states with low vaccination rates, you're far more likely to develop a new and dangerous variant.
I had a question in the Q&A about a study from the Mayo Clinic about the efficacy of Pfizer versus Mrna. Are you familiar with this?
What's the specific question? Efficacy of Pfizer versus Mrna?
It's an illusion. I'm not familiar with this myself, but a Mayo Clinic study that showed significantly less efficacy for Pfizer versus Mrna after 4 to 6 months.
Yeah, I saw that study come out. I don't know. I don't know it in depth, to be honest. I can take a look and learn more about it. But the studies generally seem to show that Moderna and Pfizer both have excellent long-term and robustness of effectiveness. But there are a study here and there that shows one is a little better than the other, and that was one study that got some media attention for that.
Well, we have a couple more minutes here. If anybody has any additional questions, we've got a few about the Johnson & Johnson vaccine. One, is it still a good option? And two, what's the status of booster, or I guess it'd be second instead of third shots for people who receive J&J the first time around?
Yeah, so to the latter part, it still is very much in the air. We haven't gotten clear guidance or really great data at this point that's publicly available on whether boosters are going to be necessary for the Johnson & Johnson vaccine. As far as whether it's a good vaccine, I'd say the answer is yes. Whatever vaccine you're comfortable getting is the vaccine that is a good vaccine. We've probably seen more studies with Pfizer and Moderna. We have a little more data with Pfizer and Moderna because they've been given to so many more people, especially in the United States, than Johnson & Johnson has. But for people who only want one dose, for people who want that full immunity 2 weeks from today, Johnson & Johnson might be the best choice for them.
Absolutely. So I think we've gone through quite a few questions from our audience here. I guess I'll close today by asking, if I have a friend who's not yet vaccinated, what sorts of things can I say to her?
So I think the things that I've found to be most effective, one is, presuming you're vaccinated, sharing your experience. We talked about how people respond to stories more than they respond to statistics. So I think sharing your experience is important. What happened after you get the vaccine? Did you get a sore arm? Were you off work for a day? Were you laid up for a day? What happened and why did you get it? I posted this question yesterday on Twitter. I got a lot of great responses. Why did people get the vaccine? People said to protect their family, to protect their patients, to protect their coworkers, to protect themselves, to protect their immunocompromised child, all sorts of different reasons. And so I think share why you decided to get the vaccine, and that's important. And then I think the last thing is just sit back and be quiet and listen and find out what their questions are. Because like I said before, a lot of times people have one very specific question. It's a thing they saw on Facebook and they're wondering about that. And is that true or is it not?
Well, Dr. Weston, you do a great job at the medical college, do a great job at Milwaukee County. You also do a great job on Twitter. What is your Twitter handle for people who might want to follow you?
Oh boy. I just joined Twitter a couple months ago, so I'm looking quick. Okay. My Twitter handle is at Ben W. Weston.
Excellent. Very much. So if you're on Twitter, give Dr. Weston a follow. Thank you to all Dr. Weston and all of our guests today. Really appreciate it. And we will see you on this program next month. Thanks so much.
Thanks, Chris.